Welcome back to my YouTube channel. In this video, we will talk about the sphenoid bone. Sphenoid Greek wedge bone resembles as a bat with outstretched wings. It comprises a body in the center to lesser wings from the anterior part of the body to greater wings from the lateral part of the body to pterygoid process directed downward from the junction of the body at the greater wings. Body of the sphenoid. It comprises six surfaces and encloses a pair of sphenoidal air sinus, superior and cerebral surface. It articulates with the ethmoid bone anteriorly and basilar part of the occipital bone posteriorly. It shows the jugum sphenoidal and sulcus sigmosus and tuberculum celli, sella turcica, dorsum celli, and clivus. Refer to the middle cranial fossa for detail. Inferior surface rostrum of the sphenoid concha, vaginal process of the medial pterygoid palate. Anterior surface sphenoidal crust articulate with the perpendicular plate of the ethmoid to form a small part of the septum of the nose. Opening of the sphenoidal air sinus is seen. Sphenoidal concha closes sphenoid air sinus, leaving the openings. Each half of the anterior surface has two parts, superolateral and inferior medial. Superolateral depression articulate with the labyrinthine of the ethmoid to complete the posterior ethmoidal air sinus. Infromedial smooth triangular area form the posterior part of the root of the nose. Posterior surface, it articulate with the basilar part of the occipital bone. Lateral surface, choroid sulcus, a broad groove curved like the letter P, F for the lodging, cavernous sinus and internal carotid artery. Below the sulcus is articulate with the greater wing of sphenoid laterally and with the pterygoid process which is directed downward. Sphenoidal air sinus. There are symmetrical air sinus in the body of the sphenoid and are closed by sphenoidal concha. The sinus open into the lateral wall of the nose and sphenoethmoidal recess above the superior concha. Greater wings. They are two strong processes which curve laterally and upward from the sides of the body. It has three surfaces. Superior are cerebral surface. It forms the floor of the middle cranial fossa and present from the before backward. Foramen rotundum, foramen ovale, imagery sphenoidal, foramen spinosum. Lateral surface. A horizontal ridge, the infratemporal crest, divides this surface into the upper or temporal surface and lower or infratemporal surface. It is biased by the foramen ovale and foramen spinosum. Its superior part presents spine of sphenoid. Refer to the norma pselis for detail. Orbital surface forms the posterior wall of the lateral wall of the orbit. Its medial border bears a small tubercle for attachment of a common tendinous string for the region of the recti muscles of the eyeball, below the medial end of the superior orbital fissure. The grooved area forms the posterior wall of the pterygopalatine fossa and is biased by the foramen rotundum. Borders are surrounding the greater wings of sphenoid. Now we will talk about the lesser wings. The lesser wings are two triangular plates projecting laterally from the anterior superior part of body. It comprises a base forming medial end of wing. It connected to the body by two roots which enclose the optic canal. Tip from the lateral end of the wing. Superior surface forming the floor of the anterior cranial fossa. Inferior surface forming the upper boundary of superior orbital fossa. Fissure. Anterior border articulate with the posterior border of the orbital palate of frontal bone. Posterior border is free and project into the stem of the lateral sulcus of the brain. Medially it terminates into the anterior clinoid process. Superior orbital fissure. It is a triangular gap through which the middle cranial fossa communicate with the orbit. The structure passing through it are put in the list of the foramina and structures passing through them. So guys, if you have any query about this, you can ask me in the comment section. Thank you so much for liking and watching the video.